Sherbold today. He's with us remotely. We'd like to recognize any public visitors we have here with us. Looks like some friends of Mallory, your family. So I will take approval of the minutes from our board meeting on October 1st. So moved.
I second.
And a move and a second. Anybody opposed? All in favor?
Aye.
And the motion carries to approve the minutes. Wonder if everybody's had a chance to look at the agenda. And if so, we'll go ahead and I'll look for a motion to approve the agenda.
I make a motion to approve the agenda as written.
I have a second? Second. Abby has a second. Oh, Marlon raised his hand too. Okay, thank you. Any opposed to the approval of the agenda? All right, all in favor?
Aye.
Aye.
Motion passes. Okay, Sadie, looks like we have the recognition of the Star Performer Award.
Right. So I just kind of like to give an overview of what the Star Performer program is. So all of our staff in the organization have an opportunity to recognize other staff members for going above and beyond, helping coworkers, helping patients, showing compassionate care, all sorts of different things. So we look at those monthly. We take it to the Employee Recognition Committee, and that committee votes on all the people that are nominated. And so this month we have Mallory England. Yeah, go up there.
In front.
Go right through there.
Go right up there.
So Mallory has been an employee at Star Valley Health for almost 7 years. She started out as a certified medical assistant, clinic manager, and then is currently our process improvement specialist. I personally had the pleasure of working closely with Mallory over the past year, and I can wholeheartedly attest to her genuine selflessness. She's one of the main reasons I love my job. Getting to collaborate with incredible people like her makes my day rewarding. This is just one small example of compassion Mallory demonstrated consistently in everything she does. This is what a staff member said about Mallory. Mallory met with one of our patients in the parking lot and helped her find the OB clinic. The patient was emotional and stressed out, and Mallory went to the gift shop and got her and her children a gift because she thought she could use the pick-me-up. The patient was very moved and very thankful for her kindness. Thank you, Mallory.
Congratulations.
Where'd you get the picture?
Yeah.
Good.
I was trying to hurry.
No, I gotta get the picture.
Thank you, Mallory. We appreciate you and what you do for this hospital. Looks like we have the Chief of Staff report next.
Oh.
For 2 seconds.
Yes,
You don't
sir.
have to sit.
I'll sit.
You wouldn't know this, but we sit in meetings. I sit in way too many meetings, like many of us, right? And we talk about things and people, and whenever your name is brought up, it's brought up as somebody that makes us better. So from a physician, medical staff standpoint, thank you. And personally, I mean, we meet way too often, by the way, but thank you. You make us better.
Thank you.
All right, you can go.
Okay.
Okay, my entire report is in 2 pictures, okay? So can we go to the other one first? Sorry, Andra. I don't know, can you guys see those? I don't know if we can.
You turn off that 1716.
This is a great picture. So Monday, I don't know, several months ago, I invited the board to come into the OR, and we had our first victim, as it were, on Monday. And so, anyway, Abby, cozied up to Dr. Green there. All right.
You always help.
Unsolicited. Just kidding. And anyway, it was amazing having Abby there. Of course, Abby's, knows a lot of folks, and a lot of people knew Abby. There were a lot of comments made, and I shared, one of these with Abby. A couple staff members came up to me while she was there and said, "Oh, we didn't know that could happen," and one of them said, "Well, I didn't think they cared enough from a board member standpoint." It was interesting. Afterwards, 3 more came up and wanted me to thank you for being there. So, your experience?
Thanks for giving me a chance, because it's your report, so I wouldn't want to say.
You are mine.
It was an incredible experience, and I would say we probably haven't been invited before, so thank you for the invitation, and strongly recommend taking that opportunity. If you ever have those things done to yourself, you're asleep, you're dead to the world, and so, man, what an opportunity. I didn't want to slow their process down, but there's so much to see and experience firsthand, and we know this is an incredible engine, and it's such a big piece of the pie to keep all of this running. So, when we say that we've got great doctors, a lot of the times we didn't die in surgery and in a good bedside manner, but getting to see them actually in their element and doing their thing, and the whole team, it was kind of a highlight of my life. So I loved it. It was great. Would strongly recommend doing it.
Where's the sign-up sheet?
You just call that guy. He's the boss.
Thank you.
It was great. Thank you.
It meant more than you. I'm not doing a very good job, I don't think, relaying that, but it meant more than you could imagine to.
That's good. We want them to know that we care about the picture.
And some of the staff may have been doctors that made those comments. So anyway, thank you. And that's all I have. Questions for me?
I need that picture.
Was there another picture?
There is, yeah. I don't know how we.
Oh.
Did I sent you both, right?
Yeah.
This is I was going to make fun of her with this other one, but she didn't need any help. She's just going to do it herself. So we don't have any patient identifiers. This is actually, and that other picture shows it better. But we were just finishing up a robot cholecystectomy or a gallbladder removal.
Oh, wow.
I know.
And, Abby got to look inside the surgeon console and kind of it's like having your head inside the abdomen. When she started to operate, we had to stop her. But
there was something
our
wrong.
malpractice insurance didn't hear that, right?
So bad, but you don't touch anything.
Anyway, and so that was it. Thank you very much for being there. It meant more than I can say to a lot of folks.
Thank you.
There you go.
Lots of
Anybody else?
Fourth quarter, it's gonna be busy. Yeah, they're all gonna come.
Bye. Thanks, guys.
It was
Yes, thanks, Abby, for doing that.
informational, not just fun. It was fun though.
Looks like we'll move on to the consent agenda. Does anybody would like to pull out anything for the consent agenda before we approve it? None? Okay, can I get a motion to approve the consent agenda?
I approve the consent agenda.
I have a motion. Jeff second, thank you. Any opposed? Okay, all approve?
Aye.
Okay, consent agenda is approved. Doesn't look like we have any unfinished business. So we will move to the Finance and Construction Committee report.
Okay.
And Jeff, are you doing that?
I'm gonna take that one.
Thank you, okay.
Yeah, thank you. So the Finance Construction Subcommittee meeting was held on Monday, October 20th. And in this meeting, management presented the financial results and statements of positions for the month ending September 30th. Some of the more significant items of note, just from some of my notes here, patient accounts receivables and the cash trapped in AR declined through the course of September. I think, again, it's really connecting back to the hospital's improved efforts at collecting on the accounts. And so I think those are seen as generally positive signs. Days cash on hand decreased. It is still, days cash on hand in September is 46 days, which is still under covenant, but it was an improvement of 2 days over August month end of 44. So I think that was also a positive thing. The short-term debt continues to decline each month, although now it is declining at a slower rate. This is primarily the result of negotiations with operating regarding eligible receivables affecting the repayment, and management originally expected that this balance would be paid in its entirety by the end of the year, but it's now looking more likely that it won't be paid until the first calendar quarter. Outpatient revenues are outperforming the plan, with increases in physician clinic visits and outpatient surgeries contributing to that success in September. It did appear that bad debt and charity deductions were starting to normalize by the end of September. If you recall, there were some more significant discounts offered as a result of paying cash on balances that were due. But that program was discontinued, so what we're seeing in September really started to become, I think, more the norm. Let's see, the committee discussed the overall cash position of the hospital, management's performance against their plan for recovery toward achieving its debt covenants, and it did seem that management's had general satisfaction with September performance against the plan. There were a few additional items discussed on the capital maintenance projects. Management reported that the Diamondville rental opportunity is now operational, with both Dr. Stuckey and McClure seeing patients there. I understand from talking with Mike, there is an open house scheduled tomorrow during Dr. Stuckey's clinic, and another one next week with Dr. McClure's clinic. And it does appear that the community seems to be supportive and excited about the opening there. It was reported that the Alpine temporary helipad is now complete. The construction on it is complete and it's available for use, which I think is a good sign of progress there. And the Alpine Clinic X-ray remodel project, it was reported that that project has been delayed a little bit due to the lack of availability on some of the materials that were required to complete that. But it does appear that the target date for completion of that is now expected to be in next month. There is a complete list of disbursements that was made for September 25 that were presented in the subcommittee, and these, along with the minutes from our subcommittee meeting, are included in the board packet as being presented, and this is my report.
Thank you, Jeff. Does anybody have any questions for Jeff on the finance report? Okay, thank you.
Yeah, you bet.
All right, quality.
The things I'd like to highlight from quality are the beginning of the Good Catch Award. Did you guys get informed of what that was going to look like? Similar to the star performer, the Good Catches in quality, we're really looking at people noticing things in the organization before they become a problem, seeing if there's like a common link between things happening and preventing a problem on the back end. So the first Good Catch Award has been awarded. Like last week, it's the cutest little mitt with a ball on it, and they'll sign that. And can we share who got that? Who was that?
Yeah. So it's Alexis Shrenkowski. She's a nurse on Med-Surg.
She found a discrepancy. When someone comes and checks in for surgery, they'll have like, don't push this medication. But then when they're like in recovery, sometimes those aren't transferring with it. And a few of the providers were like, yeah, that's been an issue. So like definitely catching things before it becomes a problem, and really put the organization on looking at what they can do to fix that, because that is going to benefit everybody. And there were all sorts of good ideas that we want to see more of that. It's not a tattletale culture. It's you're just recognizing things before they become a problem. So we're really excited about that award. It was her birthday when she received it, but we voted without names on it. We voted. It was pretty unanimous. It was a pretty significant catch that she had. All of the metrics are looking good. They're always looking for ways to improve things. One thing I'd like to note is that the system that we're going to keep track of quality process and improvements is changing in the new year, and so they're using a program called Achieve It right now. They're going to be switching to a program called Minus. I think that that's going to give us some opportunities to pull some important reports, and it's maybe going to have some growing curve, but it's going to be positive for the organization. So, I will update you. One of Mallory's comments, she updates us on the projects that are going about, and an update on the patient estimates, because with the No Surprise Act, she said that just with some different things that have been coming in, they've been able to get most of these pre-estimates they're dealing within $400 of what the actual insurance comes to. So where we know that a lot of the complaints are coming in on the billing end of things, knowing that they're having some real successes with quality improvement in that area is huge. So that is my report. Any questions?
I just piggyback on that. I'm sure.
Okay.
So, Corey Ricks and Jeremy gave just a deep dive into the clinics. And, one of the highlights for me was just what you finished on there after was major strides in getting copays gathered when people are sitting there having these, uncomfortable but yet compassionate conversations of, here's the cost, and they're getting these estimates down to where they're really close. Very encouraging. And so I got a feeling it's going to just continue to change the culture and the attitude of the entire valley. That, just like every other business, when you get the service, you got to pay the time you get the service. It just is what it is. So wonderful reports, wonderful news on this front, because major rubbing point with the community is just what you brought up.
Transparency. And maybe this isn't true, but kind of a brief conversation with you at Quality. Do you think that some people are opting to not have surgery here after they get the pre-estimate?
I think that there always will be people sensitive to their out-of-pocket.
Mm-hmm.
And if there is a lower cost alternative, they'll look for that. But others, I think they appreciate just knowing, hey, this is what it's going to cost me, and then they can weigh the options.
Yeah, that's what I wanted to say just a follow-up to that, because you said it doesn't necessarily mean they're going to have the surgery done here, but for me, like, not surprising people after they've already made the decision, they've already had the work done, then how am I going to pay for it? Right. I think it's actually noble to let somebody know in advance, and then they can make their choice.
It's without question the right thing to do.
Yeah, so just
Awesome.
very happy about that.
Thank you. That's great. So we did not have a meeting on the Ethics and Compliance and Technology Committee this month. Our next meeting will be December 4th. Foundation did not meet in October, so there's no report there. So we're to auxiliary.
And Clint completely forgot about the auxiliary meeting. So maybe Andrew, if you could pinch hit for me and fill us in. And I've got the next month in my calendar already, so I will report on that one.
They're just, they're going to have elections for new officers next week, and their next fundraising opportunity is going to be another week night, which was really fun. So put it on your calendar.
So that's Valentine's, so there's your Valentine's date night. Bingo. Thank you, Andrew. Marlo just wanted us to announce that we're going to do board elections at the November meeting, so they won't be at this meeting. Yeah, it happens every year, so, yep. And now we are to the Chief Executive Officer report.
Yes, thank you, Madam Chair. I submitted this report a couple days ago, but there's a couple things that I wanted to add that were not in the written report. One thing that I failed to mention is, and you might be curious, is how is the government shutdown impacting our facility? And here's the best explanation I can provide. Medicare is a mandatory program, so provider payments have continued, and they will continue during a lapse in appropriations. There will be some impacted areas, and where we're finding that the two impacted areas are going to be anything that was a legislative extension during the pandemic era. So think of telemedicine. Those are not permanent reimbursement initiatives. They actually had to, if those are going to continue, they're going to have to make them permanent, or they're going to have to extend them. And with the government shutdown, that's now on hold. And so where we're going to be keeping our eye on is anything reimbursement where we have telehealth services, and the telehealth right now is rheumatology, and then obviously we're looking at neurology and some other service lines. But just wanted you to be aware that that is one impacted area that we're keeping our eye on. And the last one is our administrative functions, such as provider enrollment, surveys, certifications, audits, etc. Those things have been stopped. And so we're really not even getting a lot of, even the state of Wyoming is holding off on surveys. And so we're supposed to have a survey for our nursing home, and Tori received communication that that's on hold until this is all figured out, okay? Cigna, you saw in my written report that we have agreed to financial terms, but we have just one big sticking point on the written language that we can't seem to resolve. And had a meeting this past week with them, and we shared our position, they shared their position, appreciated their insight, but we're still not budging. I think that we've made some significant concessions. They feel like they've made some significant concessions, but if we can get past this one part, which I'm not going to relay publicly what that is, just because it could impact other negotiations with other payers. But just want you to be aware that we're close, but still not past the finish line, okay?
Is there a date that you have in mind, or just whenever it's?
Just,
okay.
yeah, I don't have a date.
Okay.
So, big beautiful bill. We're coming up on the November 5th deadline for the states to submit their application, and then it's a waiting game to see how the federal government treats the state of Wyoming's application. And then part 2 of this will be how in the world is the state going to manage these funds if they're awarded those rural healthcare dollars. So from now until the end of the year, 1, did the state of Wyoming application get accepted? How much was awarded to Wyoming? And then after the first of the year, assuming that first question's answered in the positive, then we have to figure out, okay, well, now how is the state of Wyoming going to distribute these funds? And we're being told that the legislature is probably going to get involved. So that has its pros and it has its cons, but wanted you to just be aware of that update. Then lastly, we talked a little bit about this in the finance committee, is with United Healthcare getting out of all but 3 counties in the state of Wyoming for their Medicare Advantage product. Blue Cross Blue Shield is coming in and saying we're going to offer a product, and I want the board to know that it's our intention to try to reach an agreement with Blue Cross Blue Shield of Wyoming so that some type of Medicare Advantage product is offered in our area to people that need it. Okay. I won't rehash what Jeff went through with construction projects. Cash position, again, the working capital note, it balances down to 1.3 million. Days and accounts receivable have been significantly reduced. We're currently at 54.6. We're now at up to 49 days cash on hand, and we should see that continuing to rise over the next several months. And then we submitted in the board packet a written report by Jim Bands, and the details associated with all the initiatives and steps that we took to produce these results. And so again, I think it shows the effort by a lot of people in the organization to make the necessary course corrections that we learned of back in March. And then income statement performance, through first 3 months, We've exceeded our budget by 1.3 million, an 8.8% EBITDA margin. However, October's results are coming in softer than what we expected. And so we'll wait and see at the end of this week, but I wanted the board to know that based off of our PACE report, it is a softer month than prior year and to our plan. And then we had our first cyber security attack tabletop exercise. Very beneficial, very informative, very insightful, and we're preparing a written report about that tabletop exercise, and we'd like to share it with the Ethics, Compliance, and Technology Committee at our next meeting on December 4th. Okay. Merit increases were paid out to directors and managers in October. And then if you see Scott smiling a little bit more than normal, our new controller starts this coming Monday, Tanya Taylor, and we're excited to have her. And then the next community event is planned for the annual light parade, just our participation in that. So that is my report, Madam Chair. Be glad to take any questions.
And festival.
I got a question.
Oh, yes, and Festival of Trees, yes.
Oh, yeah.
Marlo's got his hand up.
Marlo?
Yeah, I know you didn't expect me to ask any questions today, so I got to ask at least one. So on Medicare Advantage, we already have a contract with Blue Cross Blue Shield. Is this all separate discussions because it's a different product, or why is it not grouped into the agreement we already have?
No, very, very good question. There's different populations when you consider contract negotiations between providers and insurance companies. And because Medicare Advantage is such a unique population and unique reimbursement and unique resources, you have to have your own separate contract versus what the contract that we would have for employers and their employees.
Okay. I think that's it for me.
Thanks, Marlo. Anybody else? Any questions for Dan? Okay, looks like we have so the employee holiday
Oh,
breakfast.
I guess I had one other question, Mandy, sorry.
Okay,
What's our plan with Jim Bands? Is he done, or is he still consulting with us? I saw his report. Sounds like things are going well, but what's our future with Mr. Bands?
So it won't be as intense, but because we have made such great strides in the whole revenue cycle process, there are still a couple areas that we're exploring, and that is utilization of resources when it comes to medical records, coding, and the like. So we want to make still a comparative analysis between our facility and their facility. That's number one. And number two is we're still trying to figure out what our strategy is to reducing our bad debt percentage as a percentage of net revenue. And so we're having conversations in that light. He then is also helping us to work with, because he has the same partnership with Revenue Enterprises with self-pay and self-pay accounts. He's helping us there a little bit. So I think that the engagement has tailed off a little bit with some very smaller projects that we're going to be working with him going forward. Anything you want to add to that?
Okay.
Scott or Mike?
Those are the big areas.
Yep.
any more, Marlo?
Thanks. No, I think that's it.
Yeah, so Dan, I guess in theory, it would be my assumption that with you guys' efforts with Jim and streamlining our process and our scripts and co-pays up front and the frank conversations of here's your cost within a couple $400 of surgeries. I mean, in theory, we should see this bad debt trickling downward within
Moving forward.
18 months,
Okay.
just as a result of those effects, correct?
Correct.
Okay, and is that something you guys expect to see?
Well, yes, we expect to see that, but we've learned that self-pay is its own animal.
Correct.
Right? And we want to be strategic about it. We would expect it to go down, but we don't want to hope that it goes down.
Right.
And so we're being very being very measured and trying to understand the details about what really are the initiatives that are going to increase our confidence level that it is going to go down.
Is self-pay the biggest threat to your bad debt?
Absolutely.
Portfolio.
It without question, it's 95%.
Are we legally able to take our excellence at pre-authorization for the surgeries and then on a cash pay patient, make that attractive to come here? Or does it have to stay at like the highest tier that we could get? We won't. I know that there's a balance. I'm trying to ask like kind of guardedly, but.
Yeah, so we feel that, or at least I feel this way, is because healthcare is just unmanageable for people without insurance.
Mm-hmm.
Okay, I mean, anybody knows that, right? It's just, and it wasn't unmanageable 10 years ago, it was unmanageable 20 years ago, and it's certainly unmanageable now, right? So we feel like we've got to, and we're having these conversations about refining some type of policy that is consistent, but still allows people without insurance to consider us, you know, and feel like Star Valley Health is an option when it comes to their family budget. And do we have it nailed down? No.
No, it's okay. It's working towards
Yeah.
that.
But that is our goal and our intention, is to try to, you know, to understand, because we feel like that more and more people actually may choose to not have health insurance. That is probably the biggest threat to our organization. And the reason why I say that is in a previous CEO report, I mentioned that people are getting out of the exchange population. There's payers that are getting out of the exchange population. And the insurance companies that are providing insurance in the exchange population, those are going to go up significantly, where it's really almost unaffordable. And so we expect to see the uninsured population to rise over the next several years in our area. And it is a threat, and we've got to be prepared to address it.
Are you seeing that already in terms of the percentage of revenues that come from, or I guess maybe not revenue, but the number of procedures performed for self-pay versus non? Are you already seeing a trend in that?
I don't know if I could call it a trend. I mean, there might be there's nothing in our numbers that say, holy cow, we've definitely got a trend, or we're not seeing it yet, because what the timing of all this come January 1 of 2026.
That's what you know.
That's when we're really going to start to see. We'll have all the pricing out. We'll understand how many people re-enrolled. And I think that's when we'll start to see it, but we're anticipating it.
When we say self-pay, are we talking no insurance and they come in cash or not to get a procedure? Or are we also considering self-pay, like if I have a 90-10, I have 10%?
It's both.
That's what I think too. So
Yeah. So when we say
I just really think that the pre-authorization really shortens the gap on that. Somebody that has to come up with 10 or 30%. I have 2 kids getting consult. I will be excited to know what that's going to hit me. I can plan for that.
Yeah, but the definition of self-pay includes both the
Co-insurance.
Deductible.
Yeah.
Those are the big ones, right? And then also those that don't have insurance that say, I'm just going to be self-insured.
Question.
Just thinking.
Marlo? Yeah, Marlo?
So Dan, in watching news articles lately, it looks like the Affordable Care Act, starting November 1, enrollment starts, I think. and they're predicting that those costs from insurance on the Affordable Care Act, those, which I think might be many in our valley, is gonna go up 30 to 50%, if I'm correct.
Yeah, that's what I was
And-
referring to. Yeah. Yeah, that's
Yeah,
what
I think we're gonna, will we know something in November, or we gotta wait till January?
Well, we know, we will know exactly what those percentages are come November 1. I mean, those haven't been shared with me. And then, but we'll also know after January 1, how many people actually, what was the previous year's enrollment and what's the current year's enrollment? And what was the, you know, we're expecting a decline in enrollment because of those costs. So I think to have a clear picture of what these changes are going to mean to our community and in our state, it's going to be after that January 1 date.
So, how do we know? Is that by zip code, or is that by just the state of Wyoming? And we gotta extrapolate based on percentages.
So based off of my understanding, it's not by zip code, it's by county.
Oh. Okay.
Who provides that statistic to you?
So I'll probably have to get a hold of, it's a State Department, I don't know, I can't think of it off the top of my head.
What?
No, it's gonna be the Department of Insurance, more in the Department of Insurance area.
Interesting.
Yeah, I would have just.
One last question. Well, it's never the last question.
Yeah, don't make promises you can't keep, Marlo.
I'm dropping that phrase from my discussion. Our own insurance, we were discussing looking at other options. I haven't heard anything more about that in the last few meetings for hospital employees. Where do we expect to be? I assume that's kind of on the market also or something. Doesn't all the renewals come up about the same time?
Yeah, so here's what I can share right now without getting myself in trouble before all of the information is ready to be baked. We made a comparison to a product with Blue Cross Blue Shield that other state entities are utilizing. We bid it out, Marlo, and it is going to be a roughly 20% increase. Okay. So, yep, and we would lose the referral of keeping our population within the Star Valley Health realm. So we have decided to pass on that. The initial numbers from our own self-insured plan, based off of actuarial data, is that we're looking only at maybe a single-digit increase for our employees. So most people out there are going to have double-digit increases.
Mine was triple.
Yours was triple?
Yeah, so I'm opting for 70-30 plan, so then I'm
Yeah.
to save $6,000 a year.
So, but I can't give you a number just yet because it hasn't been fully baked. But I think most people, if they're paying attention to what's going on with healthcare out there, should be pleasantly surprised by what Star Valley Health is able to offer this go around. Now, with that being said, it is very likely, and I want to just have the board a heads up, that we are going to do open enrollment in November for our employees, and then we're going to do another open enrollment in May so that our plan period matches our fiscal year. And now, the employees will not be negatively impacted financially. So
Yeah, because you're saying like, because your deductible years still stay on a January to January.
Yep, it still stays on January. Trevor, do you want to?
Because some teachers are.
Did I say that correctly, or
I don't think so.
No, I just wanted to clarify that with the broker right now, we've asked them to do a combined increase for the next 18 months.
Yeah.
So that we don't have to do another increase in July. It'll just remain the same.
Yep.
Which Dan's absolutely right. We're going to be in single digit increase this year, but when we lump that together, it may actually end up being a little bit more
Looking for 18
more
months.
like a potentially a 10% increase somewhere in there so then it carries us for the next 18 months. And also we can help try to build up some reserves with our insurance plan. So.
Yeah, so.
It is friendlier. I will be on record saying this, but it is true. It is friendlier to do that than to be in the single digit increase and then all of a sudden get somebody with 20%. Everybody can manage. And I will just say, I can show them my options in the real world also.
Yeah.
We're all getting
Well,
at least a 10% increase.
I will say that this is the biggest concern for most employers going forward is the amount that employees and employers are having to pay towards health insurance. It is, again, another risk to our business. And in fact, we are going to ensure, I've jokingly said that, oh my gosh, we're in business just to provide insurance to this valley. Okay. And I'm not, there's some truth to that, but with the cost of healthcare, we are also going to be layering on some aggregate insurance.
Mm-hmm.
We have learned in the past that these costs can rise so quickly that we're just completely unprepared to pay for everything. And so having aggregate insurance allows us to, we may not have to use it, I hope we don't, but it's roughly between $25,000 and $30,000 a year. But we have to have that in place just to protect the organization financially.
I'm guessing you'll take some heat for all of this discussion, but the world that we live in. And I would say, like, a lot of your employers have a spouse that has an option for insurance, and so you don't really have to offer them two for them to have two to compare to, and hopefully see that this is a great opportunity.
Well, you know what is, I think the important thing for the board and the community is to know that Star Valley Health, we're not the reason for this problem of increase in cost in healthcare. We're part of a broken system where we're just trying to survive. We're trying to make it work for our communities. And if you've seen the newspaper articles of St. John's, if you've seen what's going on with South Lincoln, if you've seen what's going on with other hospitals in the state, guys, it is. You can see why there was money put on the table by the federal government for rural health care. I mean, it has been an issue in the past, and it's more and more looking like healthcare in rural areas is just getting harder and harder and harder. And but we'll get through it. I'm very optimistic that if we're smart, we'll get through it.
Question.
Yes.
Marlo?
So, yeah, and I know our little company, we're looking at that same problem coming up as a big increase in healthcare. What I'm wondering is, we had a program rolled out that was, I know it's not a primary healthcare program. Mike was, I think, in charge of it for small employers. Will that help us at all, or is there other products that somehow we can provide that will help some of these that maybe choose not to be insured and they have at least some insurance or some method of helping costs?
So, Marlo, it's without question our program that we have for small businesses to provide a primary care benefit and, some diagnostic benefit. It's very minimal, and we feel it is a fantastic service to small businesses that really can't afford offering full-blown fully covered insurance to their employees. What we have to be extraordinarily careful about is taking that program and saying we're going to be the insurance company. And so
Agreed.
what we can do is, I guess the clear message is there has to be a boundary on what we can do and what we can't do to solve this issue of people not being insured. And there are some services that we can provide at a low cost option, but everybody wants, well, what about surgery? Or what about this drug? Or what about this? And so they're trying to push the envelope for us to offer even more services and more coverage where we become the insurance company as a healthcare delivery system. And we can't do that. So I am willing to have conversations about what we can do, but I want people not to get offended when I put my foot down and said, no, we're not going to do that. And it's not because I don't care. It's because we then enter into that realm of putting the organization at risk financially.
No, and I understand that. So are we, lack of a better word, are we pushing our product as enrollments come up and people start choosing to look elsewhere for less expensive options? What are we doing with our small employer plan? I haven't heard much about it in the last few months out in the community. Obviously, I could be missing everything.
No, you're not, Marlo. You know what is, rather than shoot from the hip, why don't we get some data? Why don't we get some data on what our program looks like to date, and then we can present that to the board, and I can put that in my CEO report. How does that sound, Marlo?
No, that's great. I think we have an opportunity to push and maybe help our community in some way, because it seemed like a pretty good product for 80-95% of the things that happen, to a family in a day. And it seemed like it could work for a lot of different types of small employers, which we have. So I'm just wondering if we shouldn't use that tool a little more than we are. And I'd love to hear some more information.
Okay.
All right. Anybody else? Okay. So just to mention the holiday breakfast, employee holiday breakfast is December 3rd, 2025 from 6 to 9. Andrew, we're supposed to let you know if we can help with that. Is that right? Okay.
No, because it is one day different than what I told you originally, just to make it easier on the
Okay.
military. We changed the date.
Well, the date is changed, so check your calendar, see if you can help with that. Looks like we'll have a 5-minute break and then go to executive session.
You want the motion now or after the break?
We could,
I make a motion to now to executive
Okay.
session
yeah,
for the purpose of.
for
Personnel,
personnel.
real estate.
You got it?
Got it?
legal- Yeah, I got it.
Okay.
For the purpose of potential litigation, legal issues, real estate acquisition. Okay, guys.
So do you just keep me on, Andra?
Yes.
I have a motion
I second.
I'm gonna keep you on.
and a second by
Okay.
Clint. Any objection? All in favor?
Aye.
Okay.
Aye.
Okay, so take a 5-minute break and then we'll go into executive session.